There is never a good time to learn that someone had a stroke. Your entire body may be impacted by a stroke, which may potentially be fatal. When the blood supply to your brain abruptly stops, a stroke occurs. Your brain cells in that region start to die when this happens. This is why a stroke is frequently referred to as a brain attack. Swift action and securing emergency assistance. To avoid serious harm or fatalities, action must be taken immediately. How then do you identify the earlier symptoms of a stroke? We'll delve into this subject and a lot more in the video we're seeing today. Before going into the early symptoms of a stroke, why notice and take quick action? We must comprehend why being alert and moving quickly are so important. Experts underline the need of seeking assistance as soon as you can. Reduce the long-term effects of a stroke. Prompt surgical assistance. The use of clot-dissolving medications or other treatments can mean the difference between life and death. Experts advise use the term f.a.s.t to identify some of the most typical stroke signs and symptoms. Let's take a closer look at the display to comprehend the acronym f.a.s.t. Quick sign. F for sagging face. Verify the individuals. Any side of the face is drooping or numb. Is the smile lopsided? A stroke is indicated by this. A for weakened arms. Abrupt, weakened or arm numbness is a major red flag. Not sure if it's a sign of danger? Query the someone to extend their arms. Seek quick assistance if the arm falters or drops. S. Speech impediment. Pay close attention to the someone is speaking. Are they speaking slurred? They are showing symptoms of a stroke. When to call. It's time to move quickly. Dial 911 right away. These are the primary indications that someone may be having a stroke. Now, let's examine the initial signs of a stroke and arm ourselves with the ability to be knowledgeable about potential future events. 1. Incapability of walking. Being unable to walk. There are various signs that someone is having a stroke. 1. A warning sign to watch for is trouble walking. Some individuals would appear fine while sitting, while conversing with others, but they won't be able to walk when they stand up. When that takes place, you can be certain that it's a stroke's early symptoms. You may even observe that they are unable to stand appropriately and exhibit a lack of limb coordination. They might even only be going. Only one of their legs is weak. It's crucial to seek help if a person exhibits any of these symptoms. Get them to a doctor so that a medical expert may examine them and decide what to do next. A portion of your brain is harmed when you have a stroke. This sends signals to your brain to become out of control, and as a result, your brain and body have trouble coordinating the actions of their limbs. It seems as though your muscles and brain are no longer communicating with one another. Additionally, your muscles can tighten up. This indicates that you won't be able to make your limbs stretch. Another sign can be a closed fist. You can tell a lot about your health from the way you walk. Over a lengthy period of time, the straightforward act of can result in significant physical changes. View our video to learn how walking benefits your health. 2. Immobility. Another red flag. I'm paralyzed. Paralysis is a stroke symptom. An individual may experience weakness or lose their abilities as paralysis sets in. To shift one's weight to one's left or right side. When someone has a stroke and becomes paralyzed, their face will appear drooping on one side. It might not be obvious right away. However, you may verify by asking them to grin. If they don't have one side of their face, it's a solid indication that anything is wrong if they don't react to the action and remain droopy. Not being able to lift their arms is another indicator. Moreover, whether they're going through, they can stumble and have trouble maintaining their equilibrium if they are paralyzed after a stroke. There are times when paralysis does not result in total immobility. Sometimes, on their skin, a person may feel tingling or prickly sensations, similar to pins and needles. The cause of this is frequently nerve injury. Considering that every stroke is different, it can be difficult to say how long the paralysis will last. Will endure. It's critical to maintain composure and avoid panicking if someone is experiencing paralysis following a stroke. Make sure they are comfortable, Work to keep them awake, and talk to them. Monitoring the person's vital signs, such as their breathing and heart rate, is an additional action you pulse. Refrain from offering them food or liquids until a doctor makes an assessment. The state of them. This is due to the fact that swallowing issues are frequently present when a stroke and might cause choking. 3. Lack of communication or comprehension. Inability to communicate or comprehend. A stroke greatly reduces the brain's capacity for language comprehension. You could, even if you find it challenging to interpret spoken language and construct words, have a good handle on it before. Slurred speech or fragmented phrases may also be a sign. When a person you're speaking to appears to be having a stroke, there may also be a confused expression on their face. This is a result of their inability to comprehend what you are saying to them. The inability to speak is a disorder known as aphasia. It not only influences how you speak, but it may also have an impact on your ability to write, read, and comprehend. Both a brain tumor and aphasia symptoms could also include indicators of degenerative illness. If someone starts talking, it is another example of aphasia to speak incomprehensibly or absurdly. 4. Migraine. There are numerous causes of headaches. Head pain. Sometimes it could be something benign like a tension headache or migraine. However, if someone has a stroke, people may feel a severe headache. Those who have experienced headaches connected stroke frequently describe its abrupt onset. The stroke would typically have happened in the exact part of the brain where the headache is located. As there is no simple solution, people tend not to be able to tell the difference between a normal headache and one brought on by a stroke. To be cautious about this symptom, most people would just assume that they must sit down and rest. It's important not to minimize a severe, unexpected headache, though. This is crucial if you have symptoms like nausea, fainting. Sometimes the headache is accompanied by frequent periods of unconsciousness lasting a few minutes. It can be difficult to distinguish between a headache brought on by a stroke and one brought on by a migraine. Done by focusing on your physical experiences. A headache brought on by a migraine usually appears. Additional symptoms such as auras or seeing flashing lights. Headaches frequently intensify, the throbbing feeling become more and more uncomfortable. Stroke-related headaches typically strike extremely suddenly. Also possible is a loss of. You experience eyesight and a sense of being lost and not knowing where you are. 5. Vision problems. Having trouble seeing is another early. Being unable to see. Evidence of a stroke. If you believe someone may be having a stroke without you knowing it, it is crucial to inquire about any vision changes they may have. In the event that a brainstem stroke is occurring, the area of the brain that controls visual equilibrium may be impacted. They might difficulty ranging from blind patches, field impairments, and partial vision loss. Hazy vision, seeing duplicates, or having trouble identifying objects. A stroke that affects the occipital lobe can impair the brain's capacity to process visual stimuli. Damaged. In such circumstances, a person can lose all vision. It's really lovely. When someone has a stroke, vision loss is typical. Right? Surprising? Research uncovered indicates about 60% of stroke survivors experience some level of vision impairment. It demonstrates how strokes can have unanticipated effects on various body regions. Remember to inform your family about the warning symptoms of a stroke now that you are aware of them. Telling them about f.a.s.t. It can significantly improve the chances that you or a loved one will be safe. Can sustain only minor damage from a stroke. If you have a greater chance of having a stroke, keep your medical history current and wear a medical identification badge at all times. Have your urgent needs. Your phone has a clear list of contacts. A stroke can pose serious risks to your health and happiness. Realizing how much damage a little clot may cause is alarming. Destruction to our body. Yet. Hey, having stated that, let's find out more about clots. Tell us in the comments section below.